Following breast cancer surgery and perhaps radiation treatment, I'm sure you're experiencing some tightness and pain in your chest wall. Oftentimes there is ischemia, which is a lack of blood flow to the area, and that can be from spasticity in the pectoral muscles. So not only do we need to stretch the chest muscles out, but we need to strengthen the back muscles and what we call the scapular stabilizers to help maintain good posture, which will also eliminate a lot of your discomfort and pain. Now, this band that I happened to grab has handles on the end, but for what we're doing here, the handles will place our arms too wide apart. So I'm going to find a position where I can get just enough tension to feel resistance, but without being too much. So a couple things to think about. If you're at risk for lymphedema, that means you've had radiation or you've had lymph nodes removed, then you want to start and progress slowly. And that means both the number of repetitions as well as the resistance you use. So I'm using a very light band right now. We'll just do a couple repetitions. And then the next day I'm going to look at my arm, make sure there's no swelling or any signs, redness, swelling, burning, tingling, heaviness. If so, you want to consult your doctor right away. But if you do this properly, you should do great and you shouldn't have any problems. Now, another warning is do not ever wrap a band or anything else that can restrict circulation around the affected side. So with breast cancer, if you had nodes removed or radiation on this side, then you'll only have to worry about the left arm and vice versa. But it's best to just learn how to grasp this between your thumb and your forefinger. And I'm sitting on a ball, which is great. I get some extra core work here by drawing in my belly button towards my spine. Of course, my feet and my thighs are parallel and going straight forward. That you can do this sitting in a chair. Just make sure you're sitting up tall. Think about a string pulling you up to the ceiling to elongate your spine. You're going to start with your arms straight out in front of you, a slight bend in your elbows, and the first thing you'll do is actually retract your shoulders, belly button in, exhale, and pull your arms out to your side. Notice I'm keeping a slight bend in my elbows and then slowly returning it to starting position. Then I repeat that, shoulders back, exhale, pull it out to the side, maintaining that bend in my elbows as well as a rigid spine and neutral pelvis. Shoulders back, exhale out, and so on and so forth. Now, if this feels difficult from the very beginning, then you certainly want to go with a lesser resistance, which is probably yellow. And I would recommend starting with just some isometric contractions, squeezing your shoulder blades together and then relaxing and squeezing and relaxing, and see how that feels first before you even add resistance. As you feel more comfortable and you don't have any negative side effects, your pain has not increased, you don't have any swelling that is obvious to you or any discomfort, then go ahead and gradually add a couple more repetitions and you can work towards higher resistance.